Hi, my name is Kimberly Homier, and I am here to discuss the public health issue of adult obesity and how it affects our population. But first, we must grasp an understanding of what adult obesity is. And to know what adult obesity is, we must know its characteristics. Obesity can be determined by the amount of fat that an individual carries, which is known as the BMI or body mass index. What is your body mass index? If your body mass index is 18.5 or lower, you are underweight. If your BMI is at 18.5 to 24.9, then you are considered a healthy weight. And if your BMI is between 25 and 29.9, then you are slightly overweight. The average adult should have a body mass index between 18.5 and 24.9. However, an individual whose obese body mass index is 30.0 or higher. Now you may wonder, what makes this a public health issue? Well, according to the Center of Disease Control, more than 1/3 of adults are obese. That means approximately 78.6 million U.S. citizens are at risk of developing preventable health problems. Obesity can cause an uber amount of health issues. Adult obesity can lead to illnesses such as high blood pressure, type 2 diabetes, coronary heart disease, sleep apnea, and strokes, just to name a few. With all the caution tape and flashing lights, why is America obese? While some of the population suffers from chronic illnesses that promote weight gain, others are obese because of factors such as being inactive or poor dieting or even social economic status. Let's first start with the inactive Americans. Being inactive is simply not exercising. According to the Department of Health and Human Services, the average adult should do at least 2 hours and 30 minutes of moderate activity and 75 minutes of intense activity per week. And as for dieting, adults should be eating their fruits and vegetables. Dieting is about finding the balance between how many calories the body needs to function versus how many calories the body actually consumes. So put down the Twinkies and pick up an apple, ladies and gentlemen. And last but certainly not least, social economic status. According to the CDC, preventative, diagnostic, and treatment services for obesity aren't always accessible to those of the lower class. Individuals may not have control over what class they fall under. However, it is still an important factor of adult obesity. Implementing adult obesity preventative courses will cost between $79 and $132 per obese individuals. This will cost the government between $3.38 billion and $6.38 billion if they choose to pick up the tab. So my fellow Americans, work out. Get a gym membership. Do physical house activity. Remember, do 2 hours and 30 minutes of moderate exercise or 75 minutes of intense exercising. Also, watch what you consume. To help track calorie consumption, the USDA has developed a website designed to track the calorie you intake daily. All you have to do is log in and record your daily food journal. And for those that cannot find the money or are of the lower economic class and do not have access to a computer, the government is trying to help. The government has established initiatives to get our Americans back in shape and healthy. Healthy People 2010 and Healthy People 2020 were established to promote healthier lifestyles. The government is working side by side with the community to reduce the weight of our Americans. Healthy People 2020 objectives in regards to obesity are to have better access to health services, to record and improve nutrition and weight status, and to promote physical activity. Those 3 factors promote healthy living and reduce adult obesity in the United States. So in conclusion, adult obesity affects millions of people daily, and there's no positive outcome from it. to reduce adult obesity is as simple as exercising and eating well. So get up and move.